G'day, I'm Professor Bruce Chater and welcome to a video about Longlook Program. University of Queensland has introduced Longlook Program this year so that you as medical students can have an integrated experience of all the terms in third year at University of Queensland, and you can do that in a lovely environment in rural areas with some really enthusiastic generalist preceptors, so you go for it.
You get hands-on clinical experience with the common stuff, you know, the suturing, the tubes, the drains and so on. And as well as that, I guess, undifferentiated presentations, you know, your common stuff, your chest pains, your acute abdomen and so on. I think what you miss on is the opportunity to see the fancy stuff. You know, for example, I've not seen a coronary artery bypass graft yet. So you lose that on Longlook, you don't have that opportunity, but I guess I view it that, well, I'll get that opportunity in a year or two's time anyway. And what I gain is that valuable practical experience, the stuff that I can actually do that will help me, I believe, in becoming a good junior doc.
Can a student doing the Longlook program have a very satisfying clinical immersion? Sure can. I think rural medicine in both the general practice and the hospital setting gives you a great opportunity to see the whole breadth and scope of what was once traditional general practice with procedural medicine thrown in. Gives you the opportunity to really consolidate your consultation skills, both history taking and examination, and on a one-to-one basis with patients, and also on a one-to-one basis with your preceptor. So I believe that what should come out of the Longlook program is somebody who is really confident and competent and comfortable with their basic clinical skills, and having seen a huge variety of medicine over the 12 months.
So to cover all the teaching that the disciplines require, we attend workshops in the orientation week at the beginning of each module. We also conduct weekly CBL tutorials, and that's via Wimber, which is a really effective computer-based program. So that's how we have our tutorials all together. And we also have access to visiting specialists that come on a regular basis to the towns, and they're usually quite keen to let us get involved in not only the consulting but also the surgical procedures as well.
Longlook was put together in collaboration with the various disciplines that make up the third year program. It's a tough process. The disciplines only gave us the thumbs up to go ahead with the Longlook program once I was able to demonstrate that the learning experiences occurring in Longlook were equivalent to the learning experiences occurring in other clinical schools. Formal teaching is provided in Longlook through an intense series of intense face-to-face workshops. It occurs with specialists who visit each Longlook town to deliver workshops. There's practical sessions with local allied health professionals, voice-over PowerPoint lectures and video conference tutorials, and weekly PBL sessions that are run by a rural generalist and a specialist from the appropriate specialty. As I said, it was a tough process to organise, but the total number of formal teaching hours are equivalent for Longlook students and non-Longlook students. But the thing is, you have a better staff to student ratio.
So when you're in your Longlook town and you're not studying, there are heaps of other things to do. Usually you've got time to spend extra time in emergency or on the wards if you want to. However, there are always things going on, not only in your town but usually in surrounding towns as well. So events like races, shows, pumpkin festivals, rodeos, that sort of thing. So if you go along to them, you'll start to recognise patients, and they'll often recognise you, and often you'll run into other local health professionals as well. So it's usually pretty fun to do things like that. And if you're into trying new things and seeing new places, then you'll never be bored in your Longlook town.
Well, look, if I didn't have a job in Stanthorpe, I suspect I'd get pretty bored pretty quickly. But the uni keeps me pretty busy. And then when I'm not doing uni stuff, there's so much going on at the hospital medically that I can't possibly convert on all the opportunities that are presented to me. So really, I don't give myself much time off, which is my choice, and I love it. I really enjoy it. But when I do have time off, when I'm looking to wind down, there's plenty of stuff to do. There's the national parks, the bushwalking, that sort of stuff, the wineries and so on. And as well as that, because you do integrate the team and you get to know the doctors, you're going around to their houses, they're coming around to your place for barbecues and so on. So there's plenty to do.
A Longlook student is a student who is looking for a unique and flexible learning experience. They don't want to be spoon-fed, and they want to take responsibility and thus the credit for their own learning. They're looking for an opportunity to get out of the city and get out of the traffic jams and get out of paying for parking. They're really excited about embracing the rural culture and the rural lifestyle and putting themselves into their rural towns and just making the most of the unique opportunity that they've been given.
I know some people would nominate self-directed and self-motivated as essential qualities for a Longlook student, but I think that's important for pretty much any medical student. I guess if you're in a metropolitan hospital, it's particularly important that you're self-motivated, because if you lose motivation and drop off the radar, no one's going to notice and pull you back on track. In Longlook, if you lose motivation, people are going to notice and be there to support you quite quickly. No, I'd probably nominate flexibility and ability to deal with uncertainty as more important attributes for a Longlook student. If you're the sort of person who likes, this student needs to go to this location at this time and experience this, stay in a metropolitan hospital, you'll love it, it's predictable, it'll work for you. Rural medicine's a lot more feast and famine. When it's busy, you just have to wade in, have great clinical immersion. When it's quieter, okay, that's the time when you put your PBLs together and do your textbook learning and review. If you can be flexible enough to ebb and flow with the demands of work in your rural environment, you're going to have a blast doing Longlook.
I originally did Longlook because I knew the two Dans would be at Stanthorpe, Dan Manahan and Dan Halliday, and I wanted to learn under them, and it's been great. They are fantastic. As well as that, I wanted to just get out of the city, basically, and kind of see a new area and get away from the massive students and get to develop my medicine myself. And finally, it was that hassle-free lifestyle. I mean, it's cliche when you talk about the country, but I love not commuting, and I don't pay rent, and it's great. It really is, and the Longlook is fantastic. I've really enjoyed it, and I'd recommend it to you.